Assalamu alaikum and welcome back to my channel Learn with Minha. Hope you're doing good. So today we'll talk about the basic skin lesions. That's an important topic when you're studying dermatology. That's a very basic and fundamental topic. Without that, you cannot proceed with learning dermatology. So let's get started with that topic. So guys, here we are with the basic skin lesions that we have to deal about. So first recapping the basic anatomy that we have so far learned about the skin. So as you know that we have the superficial layer that is known as the epidermis, then we have the dermis, and then after that we have the hypodermis. As you know, above the dermis we have the epidermis, and below the dermis we have the hypodermis, and hypodermis primarily contains the alveolar fat and the subcutaneous tissue. Whereas the epidermis contains the 5 more layers that we'll discuss in the next slide. But now we are dealing with the dermis, right? So basically, dermis is a place where the nerve endings are there, where the hair follicle, where the sebaceous gland, where the sweat gland lies, and the vascular supply is basically present in the dermis. So if you get a cut in your epidermis, so that will be known as an abrasion, and that will not leave a scar or a scab there, right? So if you have a cut in the dermis, that will profusely bleed. Why? Because there has been the blood vessels, right? So let's proceed towards the layers of epidermis. Now, so the layers of epidermis, as you know, we have 5 layers of epidermis, namely stratum corneum, lucidum, granulosum, spinosum, and basal. So these 5 layers, they are not always present in all types of skin in our body and in every location. Why? Because this layer that is known as a lucidum, this is very specific and that is very special, because this lucidum layer is present on only thick skin, whereas in the thin skin or the areas of the body that are covered with the thin skin, this layer is completely absent. Yes, I'm talking about the stratum lucidum, right? So what's the difference between the thin and the thick skin? Skin is more pressure resistant, and it's more in the areas where wear and tear happens more, and thin skin is covering generally all the body surface. So the stratum corneum is the layer that contains the dead keratinized cells. Then we have the lucidum, that is a transparent layer. Then we have the granulosum that contains the granules of the keratin, right? So that's why that is known as the granulosum. Then we have the spinosum, and this layer is responsible for providing the strength and flexibility to the skin. And lastly but not the least, we have the stratum basal, that contains the actively dividing keratinocytes and the melanocytes, right? So these are the 5 layers of the epidermis. Now after that we have the dermis, and dermis is again consisting of 2 layers, that is the papillary region and the reticular region. The papillary region basically is the region where we have the dermal papilla that interlocks or interdigitate with the upper epidermis, right? And it causes the both the epidermis and dermis to get attached to each other strongly, right? And we have the reticular layer that contains the dense irregular connective tissue. And one difference between the papillary and the reticular region is also the consistency of the, or we can say that the papillary region contains the loose connective tissue, whereas the reticular region contains the dense connective tissue. Okay. Now, moving towards the basic skin terminologies, as you can see, these are the basic skin terminologies. Okay, so we will divide these skin terminologies into 2 categories. These skin terminologies that you can see over here, they are known as the primary skin lesions, whereas these terminologies that you can see over here, not all of them, but most of them are the secondary. Most of them are secondary, right? I will tell you later which one are from the primary category or which one are from the secondary category, right? But for at this moment, like, you have to remember that these are mainly the main primary lesions. Okay, so out of these we have these 2, then these 3, and then these, right? So these macular patch, that is basically on color, right? Then these papule, plaque, and nodule are basically with level of the skin, like they are raised above the level of the skin, like that, right? And then pustule, vesicle, abscess, and cysts, they are according to the fluid consistency they contain, right? So moving towards the next slide. Now, in this picture, you can have a broad overview of these things. Like this is a macule, this is a patch, the nodule, the papule, the plaque, the bullae, the vesicle, and the pustule. Right? You can see there is a characteristic difference between all of them. And in some pictures, we have these centimeters marked as well. Why? Because these are in regard to their size. They are named in regard to their size differently. Right? So moving towards the first, that is a macule, right? So I told you that macule and patch, like both are according to the color. Okay, so basically, what is a macule? It's a flat, non-palpable lesion with a color change. Means the skin has a color change. That area is known as a macule, right? And the difference between macule and a papule is the size, right? The macule and papule are differentiated on basis of the size because macule is less than 1 centimeter and papule is more than 1 centimeter or like more than 0.5 centimeters specifically, right? So macule, what are the examples of them? Like freckles, the flat moles, nevi means in Urdu we call them till, and then the petechiae, like on the skin we have red dots or spots. And you can see this picture. This is a hypopigmented macule that varies in size, and this is the normal skin with these macules. Moving towards the next, this is also another characteristic example of macule, and you can see these are nevi, or we can say that in Urdu they are known as a till. Now we have the patch. Patch is similar to macule. It is also a color change. Means this lesion is basically a color change lesion. It could be hypopigmented or hyperpigmented. So it's also a non-palpable lesion. It's a flat lesion and similar to macule, but it's larger in size. Like it's greater than 1 centimeter. Okay. What are the examples like vitiligo, cafe, spots, and port wine stains? These are the characteristics in which you'll find patch. You can see over here, this is a patch, like these are also the patches, like this is the hypopigmented and this is the hyperpigmented patch. Now, moving towards the papule, we have covered macule and patch, that is basically a color change, right? Skin lesion. Color change, skin lesion, it's a primary lesion. Now, moving towards the third one or another category, that is a papule. Papule belongs to the group that is basically elevated or raised lesions. Okay, so the papule is basically a part of the skin lesion that are related to the elevations. So like what's happening? Means this is elevated from the normal skin surface, right? So papule is a small solid elevated lesion, and again, like macule, it is less than 1 centimeter. Macule was a flat lesion, whereas papule is a raised lesion. In macule, we have basically pigmentation that could be hypo or hyper, right? So example are warts, the elevated moles, the lichen planus, all are the characteristic example of papule. And as you will go through different dermatological conditions, you will get to know like in which condition there are macules, in which condition there are papules, in which condition you'll find patches or plaques. Right. So another picture of this is a plaque, and this plaque is basically it's a lesion that is greater than 1 centimeter in diameter. Right. Papule was less than 1 centimeter, whereas the plaque is more than 1 centimeter, right? And again, the plaque could be of different colors, of different, like it's basically plaque is not basically defined according to the color change, but we have different type of plaque. Like in this picture, you can say that this plaque is basically silver scaly plaque, right? And this is a hyperpigmented plaque, and this is basically showing telangiectasia. Like you can see blood vessels here, right? So this is a raised lesion, and in this picture you can also see this is a raised lesion. Now moving towards the another category from the elevated skin lesion, that is a nodule, and a nodule is a firm elevated lesion that is deeper and larger than a papule, can extend into the dermis or subcutaneous tissue. Okay, so nodule can be of two types, exophytic and endophytic. As you know, exo means out and endo means in. Right? So exophytic nodule is basically protruding more towards the outer surface, whereas the exophytic nodule is within the dermis more. Okay? So that would be palpated. In this picture, you can see these are different types of nodules, and you can see there is characteristic color difference. The first picture is of a sarcoidosis patient, and the second one, this is like a hemangioma that you can see in children. Like now, coming towards, we have covered the plaque, the papule, and the nodule. Now, we are coming towards the primary skin lesions that are basically categorized according to their fluid consistency that it contains, like the vesicle and the bulla. Right, we have two types. So in a vesicle is a small fluid-filled elevated lesion. Again, this is an elevated lesion that is less than 1 centimeter. Whereas a bulla, like its name suggests, it's bull. Like bull is a large being, na? So bulla means it's a large fluid-filled blister, right? In childhood, we used to do whenever the balloons were popped. So the remains of the balloons, we used to make a bully or a bulla like structure from the balloons. Like many people have experienced that. So you can remember that from the word bulla, right? So bulla is greater than 1 centimeter and vesicle is less than 1 centimeter. In vesicle you'll find in herpes simplex and chicken pox, zoster, and shingles. Whereas in bullas are found usually in burns. You can see whenever a part of the body is burned, like characteristic big areas are raised with fluid inside them, right? And the fluid is clear, usually clear, watery discharge type fluid is there, and bullous pemphigoid. Now, these are another characteristic pictures of vesicles in the bulla. You can see the vesicle is 0.5. Like in the previous ones, we have written that it's less than 1 centimeter, and more appropriately, the more appropriate one is 0.5. But if you say like 1 centimeter, it would be all right. So in the bulla, you can see these are more raised and more greater than the vesicles, and vesicles are very tiny and small. And this is a picture of herpes simplex and eczema hepatic. Now, coming towards a pustule. So, what's the difference between a vesicle and a pustule? The vesicle contains clear fluid, water-like clear fluid, whereas the pustule contains pus-filled, is basically a pus-filled lesion, and it's already 1 centimeter less in size, right? So pustule and vesicle are similar to each other, but again, pustule is less than 1 centimeter with pus filled within it, and the vesicle does not contain any pus. So pustule, you can find it in acne, in impetigo, in a folliculitis, and it's very common. So we have a single picture with three conditions. Like this is vesicle, this contains fluid, this is pustule that contains pus, and both are less than 1 centimeter, or more appropriately around 0.5 centimeter or less, and this is bulla that is large lesions with clear fluid. Now coming towards another term, that is the abscess. In an abscess, we have abscess in different, like in different, not only in the skin but in different locations in our body. So what is an abscess? It's a cavity that is filled with pus, right? It's a big cavity that's filled with pus, pyoderma or sepsis that contains the white blood cells, dead tissue, and bacteria. Like this, you can see over here. It's like basically a collection of necrotic tissue like this, where you can find the DWBCs, the dead tissue, and the bacteria, and it's a cavity that is enclosed, and it's a localized type of a cavity. Now coming towards the cyst. Okay, so there's a difference between the abscess and a cyst, because abscess was filled with the pus, whereas a cyst, is an encapsulated structure that contains a liquid or the semi-solid material, right? And it's more movable and located in the dermis of the or the subcutaneous tissue. Like this, you can see over here, it's in the dermis. So examples are epidermoid cyst or the sebaceous cyst. Like you can see over here, this is the epidermal cyst on the right upper eyelid. Now, this is also another example, digital myxoid cyst and ganglion cyst that are that are being shown over here. Okay, so coming back to our previous slides, just for a recap, कि हमने कौन-कौन से primary skin lesions कर लिए हैं. So we have this. Let me select. So I told you that these are the primary skin lesions and these are the secondary skin lesions, except this one, right? This is basically a primary skin lesion that will be covering in the later slides. But a question comes that what is the difference between the primary and the secondary skin lesion? Okay, so the main difference that lies between the primary and the secondary skin lesion is that the primary skin lesion is basically the primary insult that has happened to the skin, like due to any trauma, due to any like surgery, due to any infection, due to any burns, what has happened directly to the skin, that is known as the primary skin lesion. And what that has happened after the primary infection, trauma, surgery has resolved, but the primary lesion has resolved, that is the primary infection has resolved, that is the secondary thing, right? So we'll be covering the scales, crust, fissure, erosion, ulcer, scarring, atrophy, and erythroderma in the next few slides. So let's start with the scales and the crusts. Scales and the crust, they have a difference between them. So what are the scales? Scales are basically the dead keratinized cells, right? So scales and crust seem similar, but there is a major difference that scales are the cells, whereas the crusts are the exudates, means they are the secretions that are being secreted. या हम कह सकते हैं कि these are the, like if there is a vesicle in the in chicken pox, or like if there is a vesicle in the chicken pox, so after the condition has occurred, or after the disease has resolved, so there would be crust formation, right? So that is because of the exudates that are present within the vesicle or within the primary skin lesion. So that is crust, and the scales are basically the cells that are present in the cornea and the stratum corneum. They are the dead keratinized cells that are being shed, right? This is specifically seen with the psoriasis and the eczema. The skin is being shed off like this, and you can see over here they're the irregular, the flaky, and variable in size. And these scales can be silver, white, tan, or they can be oily, dry, thick, or thin, depending upon the condition that you are experiencing at that moment, right? And whereas the crust are the exudate. Crust are not cells. Over here you can see that this is a crust. Now this is an example, it is another example of a scale. Of the scale, you can see over here that scaling, prominent scaling is seen. These are the dead keratinized cells, and over here you can see that these white structures, these are the scales. Now over here, these are the silver or silvery white colored scales that are seen in a psoriasis patient over a plaque, right? And this is a crust. This is because the primary condition has over and the exudate has accumulated over the epidermis, right? Now, moving towards another secondary skin lesion, you may have termed you may have heard the term erosion, fissure, and ulcer. These terms seem similar, but they are completely different from each other. First, we'll do the ulcer because that's more dangerous, right? So ulcer is basically breach or break in the skin or the mucous membrane, and this is basically covering the almost the whole layers, and there is disintegration, then necrosis and necrosis of the epithelial tissue. Means ulcer is more dangerous than these erosions and the fissure. And in you can see the ulcer on the skin as well as in the mucous membranes, and as well as in the GI tract. You can see there can be ulcers, right? So next, coming towards the difference between the erosion and the fissure. In this diagram, you can see erosion and fissure are totally different. Fissure is a linear break or linear cut to the different layers of the skin, whereas erosion is superficial and it's specifically restricted to the epidermis. And like here you can see it's an intraepithelial loss of the epidermis, right? Whereas fissure can involve multiple layers of the skin, and it is usually due to the excessive xerosis or the dryness of the skin. Like in winters, you can see if you do not apply the moisturizer, there's first formation of the scales, and then ultimately if you do not take care of that may lead to fissure formation over there, or erosion. First erosion and then fissure formation, and the fissure happens usually on the on the weight dependent areas of your body, like your heels, like in the skin of the palms, and all. Then the erosion is usually in the topmost layer. Okay, so moving toward the next slide, like here, you can see this is the erosion, only the superficial layer is removed, right? Over here. Whereas the dermis is intact. These are fissures. You can see also known as the cracked heel, and these are the linear fissures that you can see in the tongue. Now this is the ulcer. You can see that there is a break in the there is a break, and it's in a very extensive break. Then the fissure was a linear break, whereas ulcer is quite like covering a more surface area than a fissure, and it's more extensive and deep than a fissure. Or, now this wheal and flare, this is basically a primary lesion. Okay, so this is usually seen in insect bites like mosquito bite or the honeybee bite, or in cases of urticaria. Or this is also used. This reaction is also used in tuberculin skin test. Right. So what is the wheal and flare? Wheal and flare means wheal is the central raised portion, and flare is the surrounding erythema or the redness or the red ring-like surrounding pattern or surrounding portion around the wheal. Right. So here you can see this is the wheal and this is the flare. Right. So wheal is a transient itchy pink swelling that disappears without taste, like it doesn't leave any mark, and they have central swelling of varying sizes and shape, and usually seen in the patients of urticaria, whereas it can be seen in the insect bite as well, and the tuberculin skin test. Now this is the dermatographism. Dermatographism or dermatographism urticaria or urticaria factitia. It is basically urticarial eruption upon pressure and trauma to the skin. Like like this skin writing you can see in this picture. If you place a pen that is blind-ended, right? If you place a pen like this, blind-ended, like doesn't open its nib, but you apply pressure on this area in a specific direction. After that, you will see that the skin will erupt like this, right? This is an urticarial eruption. Okay, so this is dermographism. Now, moving towards scars and its type, right? So, what is a scar? Scar is basically any mark on the body that will tell you that some insult has happened to the body, and that insult hasn't allowed the skin to heal completely, and there is a massive skin loss, massive or like a small amount of skin loss has been there, right? So a scar is where happens where there is a wound, burn, or sore has not healed completely, and the fibrous connective tissue has replaced that area, right? So we have three types of scar: the keloid scar, the hypertrophic scar, and the atrophic scar, right? There is a difference between all three. First, we'll go to the atrophic scar. Atrophic scar is usually seen in the conditions of acne and in the surgery, where there is a depression, like here. You can see in this diagram that there is a depression. Like this area is below the level of this normal skin, right? So atrophic scar means the skin is atrophied from here, right? In the hypertrophic and the keloid scar, both scars are basically hypertrophy, an example of hypertrophy, but there is a difference between both. How the hypertrophic scar will not expand beyond the margins of the wound, original wound, whereas a keloid scar will expand beyond the margins of the original wound. Okay, so hope it makes sense that there is a difference between the keloid and the hypertrophic scar. In both conditions, there is being hypertrophy of the wound, but problem is that in the keloid scar, like if the original wound is like this, right? So keloid scar will expand beyond its boundary, whereas the hypertrophic scar will move or will be formed around the boundary, like it would be in its margins. This is an example of the atrophic scars that is usually seen in the cases of acne. There is a depression of the sunken areas on the skin. Now coming towards the erythroderma. Erythroderma is not just a single primary lesion. It's basically a condition that is seen in multiple conditions, right? In multiple infectious conditions of the body, like infectious diseases as well, right? So it's a term applied to any inflammatory skin disease that involves more than 90% of the body surface with erythema and scaling. Means there is generalized redness of the body. More than 90% of the body surface is involved in erythroderma. Erythro means red and derma means skin, right? Derma means skin and erythro means red. So there is generalized redness of the skin. This is just a revision of these. This is bullae, this is a macule, then the nodule, the patch, the vesicle, the pustule, the plaque, the papule, the wheal, the scales, the crust, and the fissures. Like these are all the skin lesions. Out of these, we have the primary skin lesions and the secondary skin lesions. The primary skin lesions are arising due to the primary insult to the skin. Sorry, and the secondary skin lesions are usually arising after the primary insult has resolved, or after the primary infection or the surgery or anything or the trauma has resolved. Right now, the patterns and distribution of these skin lesions. There are certain patterns and certain distributions of these skin lesions. We have annular, dermatomal, zoster-form, guttate, linear, follicular, serpentinous, polygonal, radicular, and discoid. Right. So first going with this dermatomal or zoster-form. As you can see, this is zoster-form. You can remember zoster, right? Means it is only in a certain dermatome, right? You can appreciate the small vesicles that arises in the zoster. It's along a single dermatome, right? Usually in the thoracic or the lumbar area. Now, next is guttate. Guttate means shower-like. If you see, like if you see like this, if this is a person, you will see multiple lesions like this, like shower droplets. This means guttate, right? Shower droplets. Then we have the linear. It grows linearly in a linear fashion. Then we have the follicular, means it's around the follicles, hair follicles. Then we have the serpentinous. It's like snake-like, right? I will show the pictures later on. It's snake-like, right? Then polygonal. Then reticular. Reticular means like in a form of network like this. Polygonal means different shape like this. And then we have discoid. There's a difference between annular and discoid, and I will show this like this. This is an annular lesion. What is the difference between the annular and discoid? The annular will have the boundaries, okay, boundaries with central clearing. This is main difference. Whereas in discoid is uniform, means center and periphery or are like it's like this, completely fit. Whereas you can see over here in the annular, we have like this lesions. These are the raised edematous margins, whereas the center of the area is clear. Center of this region is clear. This is the linear. You can see here. This is dermatomal pattern. Only single dermatomes are involved. This is guttate or shower-like lesions. We have different like this. Then lichen planopilaris, this is basically follicular skin lesion, and lichen planus is another condition that we'll be covering in the next videos. But you can see over here, this is the follicular pattern. Then this is the serpentinous. You can see it's snake-like. And this is usually a lesion you can see in cutaneous larva migrans. This is a condition that you have bred in the infectious pathology, cutaneous larva migrans. Thank you so much for watching this video. In the next videos, we'll be talking about further dermatological conditions. If you have any questions, you can comment down in the comment section and share this video with your friends. Thank you.